Okay, we are back with another clinical conversation. Today we are with Alyssa Hurless, who is a physical therapist, orthopedic clinical specialist, and manager of orthopedic residency at CORA Physical Therapy. We, of course, have Ashley Langford, who is our Director of Clinical Excellence and Director of Clinical Excellence at the CORA Institute for Clinical Excellence. And I'm Adam, the marketing guy. Today we are talking about injuries that come from natural disasters. And it's not just the physical injuries, some of the other things that are associated with the injury, the recovery, emotional response, the stress response, etc. And so with Alyssa today, I am going to first ask, what are some of the common injuries, or first let's start, what causes the injuries post-natural disaster? We recently had two big hurricanes. What were you seeing in the clinics after these hurricanes came through?
Yeah, here in Florida, we were significantly impacted. I mean, many areas were impacted by these hurricanes, but we felt these effects of Hurricane Helene, Hurricane Milton within like 2 weeks of each other. It was pretty outstanding that this happened in that matter of time. The effects were significant clinically, on our patients, on our staff even had issues with being displaced and property damage. And you can still drive down the streets here even a month or so later and see and feel the impacts of the hurricane. Our patients that I was currently seeing had come back, the ones that did come back. Some, again, it wasn't loss of life, but it was loss of property and being displaced from the hurricane. I did have patients that weren't able to return to physical therapy for whatever reason, being evacuated or displaced. Those that I was seeing and coming back into the clinic had exacerbation of current conditions or new complaints that they were experiencing from hurricane preparedness or cleanup efforts, or other efforts that they had to do or manage the stress behind the hurricane itself.
So just the stress alone can, if I was seeing you for physical therapy, and I mean, just the stress alone, right? Thinking about this, watching the news, does my body tend to tense up, like subconsciously almost, causing the symptoms to become worse?
Yeah, we know the psychological impacts on our health are tremendous, and the tenseness is one way that it can be exhibited. Perhaps an exacerbation of underlying clinical depression or just stress and anxiety of the unknown associated with this storm that's coming, and what the impacts will be on you. So yeah, absolutely, those effects were seen before and then still lingering after. It took time. Like I kind of thought it was almost like a post-hurricane hangover, so to speak. Like, how do I get back to normal, feeling my schedule's normal, the impact it had on my children, my community, and my patients. So yeah, that was definitely obvious.
Yeah, when your routine is disrupted. I mean, even a running route when there's trees
Yeah.
down, when, yeah, you can't drive to the gym or you can't drive to PT, like you're saying, that really interrupts things. Um, and obviously I didn't even think about the preparation. You're taping windows, you're boarding windows and doors.
Yeah.
Um, all of these things are really physical activities.
Yes. Yep.
And things
Get
outside
people
your
up on
norm.
ladders. Yep.
Yeah, right? I
What
think
are what are some of the what would you say are some of the more common injuries that happen? And when you're kind of listing common injuries, why are people incurring these injuries, and what can they do to avoid these common injuries?
Yeah, I think the biggest complaints I saw as an effect for musculoskeletal injuries were back pain, which is probably the most common complaint we're seeing on an outpatient basis anyway, neck pain, and shoulder pain. Those were the biggest common complaints that I saw. Ashley, did you see anything new on
You
your
know,
end?
I mean, what I think about is it's almost taking the typical outpatient situations on steroids because,
Yeah.
particularly from a standpoint of empathy, you got people coming in that they're suffering, but they're still trying to help their neighbor, or like they're taking their chainsaw over the neighbors and lifting, and it's from the emotional standpoint, it's not like you're going to go and tell them to stop. There might be plenty of situations where you're asking someone to step away from something, but you have to find a way to help them, and yeah, it's enlightening for sure.
Yeah, people were doing things that maybe they've never done before or never thought they had to do before. I mean, I was lifting metal shutters up a ladder up onto our roof, and climbing ladders, things that are out of my normal daily activities, but out of necessity. So we kind of just took it in stride. The positivity from my patients coming back after the hurricane, thankful for that they were still well, despite their musculoskeletal complaints, was uplifting. But then dealing with those in stride, dealing with their new complaints, dealing with the exacerbation of their current complaints is what we had to focus on.
So a couple of things you were just saying, probably somebody who's generally fit, works out, it really goes back to the importance of exercise, functional movement, being able to challenge yourself in different ways. So even for somebody that's in a normal exercise routine, sometimes you have to put yourself out there in different ways to make sure you're challenging yourself. And I guess I would say even going into hurricane season, you have to be ready. It's almost like an athlete getting ready for their sports season. You're challenging yourself in that direction. You almost have to, I hate to say it, do things that are like climbing ladders with heavy objects. And it sounds so stupid, but how else do you kind of prepare? And I guess if
we
you
normally train, we would want to train for an event, right? So can us as physical therapists, we have this unique opportunity to retrain function and perhaps hurricane preparedness, making sure we're doing proper lifting techniques and minimizing that injury prevention. We're set to handle that.
Yeah, as crazy as it sounds. 2 in a row, that's reason enough to, I would say, improve your fitness.
It is an interesting topic, right? When you really dive into it, like things that you have to do around the yard, or specifically prepping for weather-related events. You don't go to the gym and mimic those things. You know what I mean? Like you really have to get creative. So I think some of it's appreciating what you're putting on your body, when in reality your mind and your focus is on something completely else, different. So
yeah. Do you ever try to pull a root that's established? Like we had a tree go down and tried, of course we can do it ourselves. We're fit, we're healthy individuals. I can take out this small tree stump, but did you ever try to pull a root that's really established in the ground? That thing's not budging. So that was another level of fitness that I was never prepared for. Yeah.
What are some of the things that can occur? So say we'll go into climbing with a heavy object, trying to pull a root out of the ground. What are some of, so let's start with, let's start with just carrying heavy objects. It happens a lot. We have to have plywood, awkward. We have shutters. We have other things, sandbags. What are things what are some of the common injuries that come from those activities? How can you prepare for prevention of those injuries?
I think the biggest thing we'll see is muscle strain, as a result of those heavy lifts. And I think, just simple tips involve taking breaks, setting yourself up for success. It was really cool to see my neighbors come over and help out where they could. So, I think the hurricane made us do things that we don't normally do. And sometimes, yes, we bite off more than we can chew in those circumstances, but allowing yourself to take sufficient rest breaks so that you're not overdoing it in those situations is really important.
Those are great points, honestly. What comes to mind is specifically that I've seen several patients for has to do with like hooking up trailers, whether it's, falling off a trailer or running into it or trying to maneuver. I mean, even the gates on those can be quite heavy. And I think what Alyssa's saying is spot on. Are you asking for help? Is there a neighbor you can you can bring over for assistance? Are you trying to get something done immediately that could wait a day and then you have help? What are your mechanics like? And obviously, if you've got help, it makes it lighter and a little easier and less risky. So, yeah, I don't know why, but trailers and anyone trying to haul off stuff or equipment seems to get a little risky.
Back pain. It reminds me of when I was in a clinic and I was working with a patient, and I would always tell them, like, posture, alignment, balance, and breath. If you have those things, you should be fine to perform your movement. And I guess if you're on a ladder carrying something up, or if you are, moving a trailer towards your vehicle, like, think of those things and you should be fine. But if you avoid them, I feel like, yeah, there's a lot of back pain in your future. If I spend the day doing these types of things, at the end of the day, what's a good way to feel better? Is taking your Tylenol appropriate, or is I don't know, hot shower, cold shower, stretching? What are some of the best ways to end the day after kind of a heavy routine of storm cleanup?
Alyssa, I'm curious to know if we align on this, because there's like a whole different like route you can go, and each person might benefit from something a little bit different. But I'll throw one idea out there, like not to coin the motion is lotion term here, but if we dummy it down, every one of our joints in our bodies like a balloon, right? And there should be so much water content and so much of the fluid that helps provide nutrition and glide, and when we have excess fluid in there, that balloon becomes swollen. So sometimes easy, gentle motion that doesn't have a whole lot of stress to it can actually push that excess fluid back out, so that we move a little easier, we feel a little less painful. So some type of easy type of movement, like for example, for knees and hips, you might have an exercise bike at home that you can ride while you watch TV without much resistance, something like that. And then, I personally haven't done it in a while, but I do know there's evidence, particularly with like magnesium absorption, like Epsom salt baths can be helpful. Doesn't mean you got to get in a whole tub, but sometimes that can help with swelling and discomfort.
Yeah, I think the thing you want to do is just like plop down on the couch and just do nothing, right? And I think that's probably the worst thing you can do in those circumstances, as much as you want to. So I'm of the mindset as well that try not to stop moving. You don't have to move to the same capacity, but some sort of active recovery is what I'd recommend. Typically for my patients who prefer one modality over another, I say, you do whatever makes you feel better in that moment. But also remember some of your pain management techniques. And what I like to cue into are some of the relaxation techniques, again, because the stress around and anxiety around this situation was so high. So tap into maybe your mindful meditation, tap into your relaxation techniques. So that way you set yourself up for a good night rest and good recovery for the next day.
Ooh, good night rest. That's a big one.
Therapeutic rest is essential.
Yeah.
Does that include wine, IPA?
Whatever makes you feel better.
Okay.
Yeah.
All right. I believe, is there anything else you want to share on the topic of kind of the injury pre and post natural disaster? Is there anything else that you want to share on that topic?
Do you want to touch on weather-related pain?
Yeah, let's go in on that.
Okay. I think because it came up in discussion, we have those patients, or I remember my grandmother predicting the weather with her knee, right? Her knee was aching and it was going to rain that day because her knee was aching, right? So we have patients that firmly believe that these weather changes, temperature changes, barometric pressure changes have an impact on their feelings of pain and their health.
Is that because they've had a surgery and there's something in there, like a screw or something in there, or that's just because of the body is doing something and it's signaling that?
So where the theory exists, I believe, is the change in the barometric pressure of the atmosphere can change the joint pressure, but is that pressure change significant and perceivable by a patient to cause pain? I'm not so convinced, and I think the research is conflicting as to how it physically presents itself. But I do think it opens the door for more communication with your patient as to as far as their pain beliefs are, or the psychological impact of their pain.
So, and that's like, so that could be storms, that could be cold weather,
Right.
warm weather, humidity, I think,
Right.
right?
Yeah.
And then also like elevation change.
Oh, perhaps, yeah, yeah. So I think all those, in theory, could have an impact, but I don't think the research is strongly supporting that it's causative.
And if somebody is experiencing like those
Mm-hmm.
events,
Mm-hmm.
do the same rules apply? Like move around, try to keep moving, try to do some of the things that you guys were just
Yeah.
talking about?
Yes. Yeah. Encourage the movement. Absolutely. And I think, and Ashley, I think it's my patients that have osteoarthritis or maybe other arthritic conditions, maybe, or just those pain sensitive patients, my patients with fibromyalgia that seem just to be a little bit more hypersensitive in general to certain movements. But yeah, treatment strategies would relatively remain the same.
Yeah, and it's interesting because, like, especially when you bring up your grandma talking about,
Yeah.
knee and the weather, and the reality is if someone has arthritis or they're a post-op patient, like their pain is their pain. So what they
Mm-hmm.
feel is what they feel. The We're just at a point now with the research and evidence where we can't necessarily provide the reasoning behind it. That's not clear.
Mm-hmm.
But it does make me think, back in the day, that was kind of the accepted thing. And nowadays, what between gluten and what you're eating and
Mm-hmm.
what you're putting, like all these different things that we're aware of, maybe, 30, 40, 50 years ago, all that stuff would have just gone back to, oh, yeah, I think it's going to rain today. But at the end of the day, it's the same thing they're experiencing. But great point, Adam. Yeah, it really comes back most likely that they're going to benefit from some type of active movement and exercise, which is what Alyssa and rehab professionals would be able to identify and address. So
Mm-hmm.
No, do patients say like, oh man, like, okay, so you're treating somebody and they call you and they're like, listen, the temperature change. So I'm in Massachusetts. It's been really warm this year and now it's beginning to get colder quickly. And would somebody have you seen a patient that's been like, okay, well, it got cold real quick and I'm like hurting.
Yeah. I mean, and
Mhm.
I have patients that live here in Florida that have moved for health reasons, right?
Mhm.
Yeah,
Because of the temperature. So whether that's mental health, emotional health, physical health, I think it's all in one in that circumstance. But yeah, I think they truly feel the impact of the weather.
Yeah.
that was a
Yeah.
good add-on. I'm glad you mentioned that. Okay, cool. All right, anything else now?
No, I would just say, kind of following up, for those that do experience any of these symptoms, I would highly support getting in to see, your physical therapist. They're able to identify what exactly do we think is potentially the cause, and what can we offer, whether it's done at
Mhm.
home or in the clinic, that might be your Tylenol without having to take a prescription. So
Yeah.
Yes.
Yeah, and I guess that lends to anybody that's maybe inactive and are realizing, man, in order to prepare and clean up after a storm, I need to be in better shape.
Mm-hmm.
Call your
Mm-hmm.
physical therapist.
Yeah. Yeah.
There's an industry plug. You guys are great stewards. Okay, we're gonna wrap this up. We are gonna do another call on and a conversation that's going to be focused towards on the clinical side of things. And so if you are a new clinician and you're moving to maybe a storm prone state, which I don't, there are a few that aren't these days. that might be a good one to tune into because you'll hear a little bit more about the clinical approach to this story. So, all right. Thank you, Alyssa. Thank you, Ashley. And we're wrapping it up. See you guys soon.
Thanks for
Thank
having
you.
me.